Hi, my name is Dr. John Holtzen, oral and maxillofacial surgeon at Alpine Oral and Facial Surgery. If you're watching this video, more than likely you or a loved one have either recently had teeth removed or other oral surgery procedures, or you're just about to undergo this. We wanted to make this video available so you will have ready access to the most important essential information following your surgery. One of the most important things for you to know is what to expect after surgery. For most patients, the experience of having teeth removed is fairly unremarkable. Almost everyone, however, will experience some degree of discomfort, some swelling, some bruising, and some bleeding. The amount of pain you will experience after surgery is very difficult to predict. Some patients can have a major surgery, but have almost no discomfort following and require little or no pain medicine. Other patients have a relatively small procedure, but still experience a lot of discomfort that's difficult to control with pain medicine. What you will experience depends largely on the complexity of your surgery, but also is determined by how your body responds to inflammation and how you perceive that response. We'll talk in another video about how to take care of yourself after surgery and things you can do to reduce the amount of pain you will experience. Probably the most important point to remember about pain is that we expect all the negative sensations after surgery of pain, inflammation, and swelling to increase continually for about 3 to 4 days. Most people will reach their peak of discomfort at day 4 and then start to slowly improve with ups and downs through the days. Most patients will require some degree of pain medicine for about 7 to 10 days following surgery. For some patients, pain medicine may be required even longer than that. Another thing to be aware of is that the muscles that close your mouth often become very inflamed after a tooth is removed. This can make opening your mouth very difficult or tight. It can sometimes take several weeks for these muscles to relax and your ability to open to come back to normal. With regard to swelling, just like pain, it should reach its peak at about day 4 after surgery. Also like pain, the amount of swelling you experience is highly variable. The swelling is also usually uneven, with one area swelling more than others, and this is not necessarily a sign that anything is wrong. Some patients will experience a lot of swelling, some patients will have none. This usually relates to the complexity of the surgery, but not always. Most of the swelling should also resolve over about 7 to 10 days. Some patients will also have bruising on their face or their neck after surgery. If you are older or fair-skinned, or take medications which thin your blood, the bruising from even a small procedure can be very dramatic. Although bruising can look very worrisome, it is a normal consequence of surgery and just represents some blood that escapes out into your tissue. Bruising also tends to follow gravity, so it will slowly work its way down onto your neck, and for some patients even lower. Don't be concerned about the appearance of your bruise, and it will slowly resolve just like a bruise anywhere else on your body. You will experience some degree of bleeding as well that persists for a time after surgery. We'll talk a little bit more about how to manage that in a separate video, but the most important thing to realize is that a little bit of oozing off and on, even for several days after surgery, is normal. Just movement of your tongue or eating or talking can stimulate a little bit of bleeding. If you don't have heavy flowing blood, it is usually nothing to be concerned about. The last thing I'll point out that you should expect is that during surgery, you will almost always be injected with a type of numbing medicine like Novocaine. This is to help control your pain after surgery for a time until you can get home and start to get some medicine into your system to control the discomfort. That numbness may last for up to 12 hours or longer, depending on what kind of medication is used. So these are the most common things you can expect to experience after a tooth removal or other oral surgery procedure. I hope this information is helpful. Be sure and ask any questions you have about these things and call us if you're at all worried. We're available by phone 24 hours a day, so don't hesitate to reach out if you need us.